think most people by now know me. I'm as a chair of the German Alliance Climate Change and Health. I have had a many year interest into global health and work in global environments. That's why I also know a lot of people here in Eastern Africa, and I'm very happy that the hub is founded and that we are having first activities. And I'm especially pleased to be able to introduce as a first speaker for today, Kris Murray. We have been knowing each other since last year and have had a few exchanges. Kris is a disease ecologist and has worked in the interface of human, wildlife, and environmental health for the past 15 years. He joined Imperial College London in 2015 to work on environment and health, leading in the Grantham Institute Climate Change and the Environment, and then is now, before moving to the Department of Infectious Disease Epidemiology in 2018. He now took up a position at the MCR unit, the Gambia of the London School of Hygiene and Tropical Medicine, where he is Associate Professor of Environment and Health, and will develop a new research theme on planetary health. So Kris, before you start with your presentation, I would just start with a question to you. I mean, you are now moved to Gambia and you've had a long-term interest in planetary health. Why did you move to Gambia at that point in time?
Yeah, that's a very good question. It's obviously a fairly dramatic move to pick myself up, having been already in New York and then subsequently in London. I'm from Australia to begin with, so I'm quite far from home, and now even further from home, having moved recently to the Gambia. Really, I think the real reason is because of the opportunity that it sort of presents itself down here. As Martin said, I'm part of the MRC unit at London School of Hygiene and Tropical Medicine, which has been in the Gambia for something like 70 years, working on international and global health issues, according to sort of three, what I would frame as fairly traditional themes in global health. And what we've sort of had in the last sort of couple of years is this sort of emerging interest in planetary health processes, or the role of the environment in shaping health. And that's coming from quite high up in terms of funders, as well as from interest at the MRC itself. So there was a position created down here to which I applied, and I just thought it was an amazing opportunity to try to put some of the work that I've done in the past sort of 10 years into some form of more practical application, have a sort of an outlet for the work that I've been doing, and have a place where I think it really has the potential to have a huge impact. Not that it doesn't have impact elsewhere, but I just think that this is just a fantastic time to be working on planetary health in Africa and other parts of the world. So that's the main motivation. And and so I can just launch straight into my talk. I didn't sort of consider the COVID-19 part too much in this, because Martin sort of suggested that I should try to represent my interest in biodiversity and the intersection between biodiversity and health. And I think that COVID-19 is really, really well framed in that context. But most of what I've got to say about that is actually based on other diseases and other work that we've been doing and that other people have been doing. So I thought maybe an overall sort of a general overview of the links between the environment and disease emergence would be the way to go to sort of frame and set up this session. And then later we can talk about the stuff that's a little bit more specific to COVID, perhaps with Jennifer's talk following and in the discussion following that. So without further delay, let me just pull up this presentation. And I should say that this does actually represent I'm co-appointed, so I'm 50% employed by the MRC unit, but I'm also still 50% employed by Imperial College London, where I've been based for the last 5 years. And so there's this sort of, I have this bipolar kind of perspective on things at the moment, having sort of been splitting my time between these two very different places. Okay, so I just want to sort of start with the big picture here. I don't think that we can really contest that health has possibly never looked better on planet Earth than it does right now. I mean, maybe not right now, let's assume we're not in the middle of a global pandemic, but in general, all the metrics around health, most of the metrics around health are sort of painting a very good picture. The successes that we've had in global health in particular have been what I would call extreme in the last sort of 50 to 70 years. And you can see that by this inset diagram here, which is the life expectancy for all the countries on Earth. And you can see with very few exceptions, people are living to a much older age than they have been, irrespective of the place on the development spectrum that countries are falling. There's been this massive success in improving global health, and this is underpinned by all of the other metrics that you would expect, like child mortality and all of the things that you would imagine go into creating a healthy society. Most of those metrics are looking really good. The big picture represents the share of the global burden of disease that is split between non-communicable diseases in blue and other diseases, and the other disease categories in this picture here are primarily infection related, but also child and maternal health related. And you can see that there's been the major shift in the last sort of 25 years or so has been this huge decline in the burden of infectious disease as an overall share of the global burden of disease. That's not to say that we are yet close to eliminating infectious diseases, although if you follow that trajectory out, that you might expect that infectious diseases could be well and truly under control within the next century, assuming this excellent progress is continued. But there are some areas of infectious disease, the burden of infectious disease or other indicators of infectious disease risk, including incidence, the distribution of diseases, and in some cases the impacts of the burden, where the trend is going in the opposite direction. So there's select diseases for which we can see there's an increase in these things. So I've got some examples here from a paper by Sebastian Funk from a few years ago, showing that worldwide plague cases have increased in the last sort of maybe 40 years or so. Rabies, Lyme disease, hantavirus, and this is just an example. This is just a few examples of a bunch of different diseases that are just doing pretty weird things, recently weird things in terms of their escalating risk. Beyond diseases that we know well, that we know about, endemic diseases, we have this category of diseases. It's actually kind of like more of a melting pot of diseases that we call emerging infectious diseases. And these are the diseases that are either novel, completely novel. They're diseases that are doing weird things, changing their distribution, increasing their incidence, changing their clinical presentation, things like that, switching host species. These are all the diseases that we call emerging infections. And what we kind of sort of characterized in the last 50 years or so is that there is an increase in this type of diseases. This is still a little bit of a contentious kind of trend here. It's very, very hard to really track emerging infections because they're so multiplicitous in their nature, and also they're strongly confounded by our ability to detect new diseases and diseases that are doing weird things. We're getting better and better at coping with this kind of things, doing surveillance and working out where these things are coming from. Nevertheless, it looks like there is this overall increase in this emergence rate. And of course, most of these emerging infections are having relatively small impacts, but some of them go on to just cause catastrophic impacts, including pandemics. So some examples that I've just put here: plague killed 1/3 of the European population. The flu killed 50 to 100 million people around about 100 years ago. HIV, huge number of cases and deaths worldwide now, really characterized the pandemic of our age up until 2020, when we, of course, welcomed, or in fact, we did not welcome COVID-19 into the mix. The thing about emerging infections is that mostly they're coming from animals, so we call them zoonotic diseases, and that is also true for endemic diseases. We share most of the diseases that we have in the human population are also shared with animals. And for emerging infections, around about 45% of the total, or 70 to 75% of those zoonotic diseases are coming from wildlife specifically. This is my slide acknowledging the presence of the current pandemic that we're in, the SARS coronavirus 2, which is the cause, the virus that causes COVID-19. And this is another example of a pathogen that's got into the human population that has a likely wildlife origin. And in this case, the screening of samples suggests, and working out sort of evolutionary relationships between the virus causing COVID-19, it looks like it groups with a bunch of coronaviruses that are associated with rhinolophus bats, which is a large family of bats that we call the horseshoe bats. So here's a kind of a conceptual model of how I sort of think about disease and disease emergence processes and disease geography, really. And I'm sort of starting here from the bottom. So if you go to the very bottom of this diagram here, we've got these two layers, the geography layer and the environment layer. This represents sort of like the topography of an area overlaid by the sort of climatic features of that area. And then those things shape the distribution of vectors and reservoir species, as well as humans to a certain extent. And we have, of course, pathogens sort of moving in that general kind of sphere. The interactions between humans and vectors and reservoirs is what connects us to pathogens and allows us to share pathogens with the environment, with reservoirs and vectors. And if you keep going up that chain, you can imagine that if you understand what's happening with geography and the environment, you can start to understand what's shaping the distribution and impact of diseases. And that's what I've got at the top of this figure here, these layers of which represent individual diseases in space, and then the combination of features essentially describes the distribution and the risks that these diseases present. And so because of that, those lower layers, those geography and environment layers, we see this very strong influence of those factors, things like land cover and land use, as well as climate, on the dynamics of zoonotic and vector-borne diseases in particular. This is a figure that I've taken from a recent master's student thesis that I supervised, conducted by Elise Sager from the University of Utrecht. And what we did here is simulate the growth potential of a mosquito vector in an area of primary forest that was being converted into palm oil plantations. And what you can see with the simulation is that where you have these cycles of deforestation followed by palm oil production, followed by cutting the palm oil to plant a new generation of palm, you get these cycles of elevated risk in comparison to a deforestation event and then letting that forest just regrow. Basically, what's happening here is that you're periodically making the environment more conducive to the growth of this vector species. And that sort of process, I mean, there are many different individual mechanisms, but this type of process is leading to this sort of surge in interesting cases of individual diseases and the prominence of land use as a feature driving infectious disease ecology is increasingly coming onto the radar. The other aspect I've talked about here is the climatic influence. That's where I've got this sort of this colorful environment layer at the bottom of my diagram. If you follow the climate up through this conceptual model, what we tend to see is that the climate is shaping, in addition to the reservoirs and the vectors, the combination is similarly shaping the distribution and in some cases the incidence, the prevalence, the impact of some infections. The figure I've got at the top there is just a simulation looking at the projected effects of climate change on the distribution of Chagas disease. And you can see that there are increases and decreases in risk depending on the combination of climatic features and how that relates to the sort of the niche of the reservoir species and the vectors of Chagas disease. And then on the right-hand side, I've got a figure showing some work that we've been doing with the Lancet Countdown on Health and Climate Change, broadly showing that the world has sort of increased in suitability for a bunch of diseases. We've got 4 or 5 diseases tracked in this program at the moment, and I'm just showing you at the top dengue. So overall, we've seen about a 10% increase in the suitability for dengue transmission at a global level since 1950. And similarly, on the bottom, we have this increase in suitability for cholera, for the bacteria that causes cholera. In here showing a couple of places where we've done the analysis in the Baltic Sea and in the northeast of the United States. So we can see these strong influences of land use and climate on disease ecology. The issue with trying to work out the net effect of these processes and these changes is that it becomes very complicated very quickly. And you just have to look at some stats for the community of pathogens that we have in people to kind of realize how monumental this effort really would be to try to work out what the sort of overall effect might be. So we have around about 2,000 known species of pathogens affecting humans at present, a couple of hundred viruses, about 1,000 bacteria, 400 or 500 fungi, and a few other things, including worms. And so it's quite a reasonable amount of diversity of things that are trying to, to parasitize us essentially. So it's quite complicated to imagine doing individual disease-specific models for all of these different things to try to work out what the net effects of global change might be. So we've sort of started to think about whether we can kind of flip this process on its head. And I should say that when it comes to the way that these pathogens are causing disease in people, the predominant pathway we see is this zoonotic link. So most of these diseases have animal reservoirs. Around about 70% of the pathogens in our database, which represents sort of a subset of these 2,000 known pathogen species, 70% come from animal reservoirs or have an animal reservoir involved. And of those, almost all of them have multiple species of reservoirs. It's not just that we're talking about a single species of bat or rat, so we're talking about multiple species of animal reservoirs. The same is true if we're dealing with vector-borne diseases. Most vector-borne diseases don't just have one vector, they have multiple vectors. And then if you try to look at just the diseases that involve animals, a decent chunk of those also involve vectors. Around about 40% of zoonotic diseases also have a vector involved. And then of the vector-borne diseases, around about 90% also have a reservoir species involved. So we've got this incredibly complex ecology for almost all diseases that we really, that we know about and care about. In addition to that, we have this kind of what we consider this pool of potential pathogens that exist in nature. Nature is the source of the majority of these pathogens, and some estimates put the number of unknown zoonotic viruses, so that's not even including all the bacteria and fungi and worms, at around about 10,000. Other studies suggest up to about 1 million of these unknown zoonotic viruses in mammals. So really most of the risk that we're dealing with emerging infections, for novel emerging infections, we just have no idea about the ecology, zero idea about the ecology. So it's a monumental task to imagine how to work out where these risks are coming from and what they really represent. So just to summarize that, most human infectious diseases are zoonotic, that's endemic and emerging infections. And if it's a zoonotic disease, then there's usually multiple zoonotic hosts. And if you're zoonotic, then 40% of those zoonotic diseases also have vectors. If you're a vector-borne disease, then typically there'll be multiple vectors. And if you're a vector-borne disease, then almost all of you are also have an animal reservoir involved somewhere along the way. And then most pathogens that represent novel risks are completely unknown. So it's a very, very muddy waters. So you can imagine, instead of going up this tree from the bottom, what we can do is look down from the top. And here we have this kind of model where we've got the sort of sum pattern of all of the infectious diseases that we have information about. And what we're trying to do here is infer what some of those processes that are shaping those patterns are doing and what they might do in the future if they continue to change. So here's a map of the total zoonotic disease richness in the world. That means the total number of zoonotic diseases that a country has recorded in whatever database they're maintaining. And you can see in yellow, we've got 110 different zoonotic infections in some places, but that's very variable. It's hugely heterogeneous across the planet. So we asked the question here, what is shaping the distribution or this heterogeneity in pathogen richness at a global level? And we can ask questions like, is it the environment? Is it the travel networks? Is it climate in particular? Is it is it the health expenditure? So if we run all of this stuff through some statistical models, I've just shown you here what this might look like. This is a map showing the climate similarity. So in red, you've got kind of broadly tropical areas, and in blue, you've got kind of broadly cold Arctic tundra kind of areas. And we can ask the question, is the variation in climate responsible for shaping that distribution of disease diversity at a global level? Another example is the flight network. We might hypothesize that countries that are increasingly connected are also have a higher tendency to import novel diseases and increase their disease richness. So we can compete these covariates or these hypotheses against each other to try to work out what are the most important features shaping global pathogen diversity. To cut a rather long and complicated story short, I've provided here a summary of a model that explains this global disease diversity. And in green, we have positive associations, and in red, we have negative associations. And all of these associations showed here are significant associations. Sorry, all of the associations that are starred are significant associations. So if we start on the right-hand side, we can see health expenditure is negatively associated with disease richness. So that suggests that what we're doing from a health management perspective is having an effect on limiting the disease diversity that a country is reporting. Also on that human side, we have connectivity. So this is saying that countries that are more connected, we can detect the positive contribution of these importations of disease through this connectivity network. And interestingly, in this case, if you're connected to a country that also has higher zoonotic diseases, then this model fits even better. So it's really the connectivity with other places that have diseases that you didn't have that increases the risk of importing these diseases. On the left-hand side, we have some other kind of more environmental features. We have mammal diversity being the primary explanatory factor that shapes or that explains the disease richness patterns at a global level. We have climate with a direct positive association. So that in here, positive means if you're more tropical, you're more likely to have more diseases. And then all of these arrows that are sort of interconnected show that these things are not independent factors. They're actually interdependent. So climate is shaping the diversity patterns of mammals, and it's contributing significantly to disease richness via that pathway. So it's quite a complex figure to get your head around, but the point here is that we have both human-related factors and natural environmental related factors that are contributing to disease richness patterns at a global level. So I've got about 5 minutes left, I guess, if my timing was correct at the beginning. So I'm just going to sort of summarize this stuff in terms of where we are right now. So this is a figure that I pulled from a paper looking at all the different threats to biodiversity in the world. We have overexploitation, agricultural activity, urban development, disease, pollution, climate change, for example. These are the big factors that are shaping and leading to biodiversity loss at a global level. On the other hand, we have some science that suggests actually that biodiversity loss, contrary to the results of that model that I just showed you, suggesting that biodiversity increases your disease richness, there's some science to show that if you remove the biodiversity from a system, you also increase the risk of infectious diseases. And that's because you're doing funny things to the natural disease dynamics in a landscape. You could be increasing the contact between humans and people in modified landscapes. You could be perturbing the natural disease dynamics through things like immunity effects. If you're stressing animals, they may be more likely to have diseases spill over between each other. And then there's some suggestion also that in modified landscapes, we're actually selecting for host species that are better at hosting zoonotic pathogens affecting humans. So it's a very complex story here. On the climate side, we know that climate change is affecting just about everything that we've looked at. This is a summary from a science paper showing that 82% of 94 processes that have been examined in any detail are showing signatures or fingerprints of climate change in these processes. And that's occurring at the organismic level or the suborganismic level, genes, right through to entire communities. In addition, we know climate change is another threat to biodiversity, in addition to habitat loss, as that figure showed before. This is a projection from, it's actually a sort of like a meta projection from a bunch of different studies showing that we might expect around about 8% of species to become extinct due to climate change. And that's obviously worse. The predictions are worse or more dire the more climate change that you factor into the model. We also know that climate change affects the distribution of these species in space, and it's the overlap between mammalian species and other species that explain the viral sharing network. So if you start to change the climate, things start to move around and you start creating novel opportunities for new spillovers to occur, for new transmission events between species to occur. And if we sum up all of this stuff, this is really the kind of thing that is being used to characterize this kind of new concept of a geological epoch that we're calling the Anthropocene, characterized by some of these ginormous global changes that you will all be very familiar with, being interested in planetary health from the get-go. But for example, we've modified 50% of the Earth's ice-free land surface. We've raised sea levels by a couple of millimeters. But we are by a couple of millimeters per year, and that's accelerating. We've acidified the oceans by 30%. We've increased the rate of extinction by 3 or 4 orders of magnitude. And of course, we've increased the global temperature by more than 1 degree on average since the Industrial Revolution. So these are just absolutely ginormous ecological and environmental changes that the Earth is experiencing. And I hope you'll see how that is sort of sending these alarm bells off in the minds of disease ecologists like me, given what I've presented about the influences of the environment on disease risks. Where we are right now, this is a human footprint map showing the change in our pressure on the planet since, in actually a surprisingly short period, a 12-year period between the first assessment in 2000 and a second assessment in 2010 or 12-ish. What the areas in red show are areas that are getting more heavily impacted, and the areas in green, areas that are actually having less human pressure being placed upon them due to things like reforestation or the urban migration, for example, from rural areas, which tends to lower the pressure in areas outside cities. But on the whole, there are far more areas that are getting worse than getting better in terms of the human footprint index. So we're not in a good position from the perspective of environmental change. So for me, to summarize the results of this sort of simple model that I presented before, on the right-hand side, we have factors that are, broadly of our own doing. They're human, characteristics like our spending on health, our propensities to travel. These are things that are affecting global disease richness that are broadly within our control. We have some control over them. On the left-hand side, we have things that we're affecting very, very severely, things like biodiversity and climate, but we are doing it in a way that is completely uncontrolled. It's unprecedented. It's an unprecedented experiment that we're doing here. And we really have very little idea what the culmination of these effects will be. But in this case, we can see there should be very significant effects on the global diversity of diseases and the disease risks that they represent. I'll skip these slides in the interest of time, but just leave you with the thought about COVID-19 in particular. So I mentioned before, it is a disease with a likely wildlife origin. The coronavirus is in the family from which SARS-2 comes from, is associated with horseshoe bats. But at the moment, the evidence around the role of environmental change and the emergence of COVID is basically non-existent. We have circumstantial evidence about its association with a wet market in Wuhan, in China. And the rest that we have is we're just basically speculating on the strength of these other observations that I've been talking about, examples from other disease systems where we've seen certain pathways kind of float to the surface of this sort of fairly messy pool of potential mechanisms. There is currently a in-depth investigation that's been led by WHO. They're in China right now, as I understand, the first couple of days of this dedicated investigation to try to resolve the origins of COVID-19, the first spillover event. That may be possible. My guess is it's very, very unlikely that we will get the smoking gun even through this investigation. So we still don't know what the role of the wildlife trade is. We don't know what its intermediate reservoir hosts are, or whether there indeed are some. And we don't know anything about, wildlife harvesting, what the role of the market really was in mechanistically causing this spillover event to have occurred. I'll leave you just with my summary slides. I don't think I need to go through them, but other than just to say that this is a very complex area of science. When we're trying to look at the connections between the environment and human health outcomes, we can see the contributions of all of these different factors, biodiversity, habitats, land use, climate, in shaping the global disease risk kind of landscape. It's still too early to tell what happened with COVID-19, but it's definitely not too early to start using some of the lessons that COVID-19 and observing some of the responses that we've been able to muster as a global human population to cope with this global health threat, and think about how we might do the same types of things or similar types of things, or leverage some of the insights that we've had and apply them to other global planetary health threats, including what's going to happen with land use change and biodiversity loss, what's going to happen with climate change. And here, this is where I really think that planetary health is starting to contribute some very interesting sort of novel ideas about creating policies and taking actions that deliver co-benefits for human health and the environment in this sort of broader scheme of sustainability. I think that's it. Thank you very much.
Well, thank you very much, Kris, for this very comprehensive and at the same time kind of broad and view on the complexities of this other perspective on planetary health, because I think from all the conversations we've had so far and lectures, this was the most rich inquiry into the biodiversity and infectious disease kind of lens. So I'm now very happy to hand over to Jennifer Cole. Jennifer, you are a biological anthropologist and hold a PhD in computer science and biology. You have been a public health policy advisor to the Rockefeller Foundation Economic Council on Planetary Health. You are currently a research fellow at Royal Holloway's Department of Geography. You are also author of the book Planetary Health, Human Health in an Area of Global Environmental Change. You were joining us yesterday in the International Planetary Health Lecture, where we discussed as an ethical perspective on planetary health. And it's great to have you here as an economist, anthropologist, as a biologist to bring in your perspective. And then we will have, after your talk, we will have the discussion with the audience.
Thanks for the introduction. I thought I'd use this lecture for a little bit to kind of push the importance of social science in planetary health research, using really COVID-19 and Africa as an example. To give you a bit of a background, I'm not surprised that my background kind of quite slightly confused Martin trying to get it through. I have a very interdisciplinary background. I was originally a biological anthropologist with my undergraduate degree, and that's still what I would consider myself to be. So I'm an anthropologist who's interested in biological processes and health. I then worked for a long time at the Royal United Services Institute, which is essentially a security think tank. And very much there, I was looking at disease as a threat on countries' national risk registers. So threats very much in terms of global health security and the impact on countries and the economy. From there, I went to Royal Holloway, where my PhD was in computer science and geography, but within the School of Biological Sciences. So again, very, very cross-disciplinary, essentially looking at how people searched for health information, particularly online, during the Ebola crisis. And then I went from there to Oxford, where I worked on the Rockefeller Foundation Economic Council on Planetary Health. So my research has always been based around health and kind of large-scale health risks and the impact of health at societal level. Both nationally and internationally, but also down at community levels as well. My experience with Africa is mostly with Malawi in terms of actual field work and being out in Africa. I said my PhD was on Ebola, but that was very much desk-based research from the UK. I wasn't actually, my university wouldn't allow me under health and safety to actually go out to West Africa in the middle of an Ebola crisis, unfortunately. But I interviewed people and particularly looked at health-seeking behaviour. And one of the things that this has always shown me is really the importance of factors other than the biology and the virology of disease. Very much during the Ebola crisis, Paul Farmer, who's a medical anthropologist who was working with Médecins Sans Frontières, made the point that actually the real risk from Ebola was not necessarily the disease itself, but it was the fragility of the healthcare systems in the countries that it affected. And you could look at statistics around the number of doctors per member of the population, the number of hospitals per member of the population, the amount of money that was spent on health. And all of these had a huge impact on how Ebola impacted on those countries. One statistic that has always stuck in my mind is that if you looked at the number of doctors per members of people in or citizens in Liberia, it was the equivalent of having one doctor for the whole of Wolverhampton, which is a decent sized city in the UK, about 150,000 people. And that was not one doctor on call whenever you wanted them. That was one doctor. So if they only worked 8 hours a day and needed sleep and had days off and were sick themselves sometimes, during those times, the entire city wouldn't have a doctor. And yet we were expecting them to deal with an Ebola crisis. So I think sometimes looking at those figures behind the statistics and actually seeing how do those actually relate to the society on the ground can really help you to kind of conceptualize the scale of the problem. And that's also been writ large again really during the COVID-19 pandemic, where there's been a lot of impact on whether kind of poverty, degraded health systems, both within developed countries and in developing countries. And a quote from Dr. Fauci from the US National Institute of Allergies and Infectious Diseases that said, if ever there's time to make a real commitment to the social determinants of health, it's got to be now. And that's something I've been very much trying to bring into planetary health, is this need to actually understand society, to understand the anthropology, the sociology, the human geography of the environments that we're working with, so that we can actually understand both the human health, the environments, and the human-animal interactions, and the human and animal interactions with the environment as well. So if we look at Africa and the impact that COVID-19 has had on Africa so far, very much at the beginning of the pandemic, there was real concern that the degraded healthcare systems in some areas of Africa, whether that was due to kind of conflict that has disrupted them, or healthcare systems in areas where there's never really been the opportunity to develop in the first place, would mean that COVID-19 hit Africa extremely hard and perhaps hit it worse than other parts of the world. But interestingly, we haven't seen that. What we've actually seen is that the worst impact of COVID-19 tends to be on the more developed countries. And certainly you can see that Western Europe and North America has been badly hit. And within Africa, it's areas like South Africa that are generally considered to be more the BRIC nations that have had the worst impact. And so one of the things I've been quite interested in is actually what is behind this. Is it just the climate? Is it down to the demographics? If you don't have a very strong healthcare system, you tend not to have large numbers of the population who are able to live with long-term health conditions. So perhaps those people, you don't have so many people living into their 80s, which is the highest risk group. And what does this actually mean in terms of the way that healthcare is arranged and delivered into the future, or perhaps where we consider putting some of the resources? And this certainly ties in as well with the number of healthcare workers as well. One thing we see is when healthcare workers are trained in Africa, they tend to leave for jobs in America and Europe, which again creates that cycle going round of there being not always enough healthcare to go around in Africa. When we come to see vaccine development, what will happen to countries who can't easily afford the vaccines or can't afford to outbid other countries to the vaccines? And so I think we do always, whenever we're looking at pandemic, need to be taking in these more societal and anthropological factors. So if you ask questions about what's caused the pandemic, the obvious thing is the virus, and we can say it's the SARS-CoV virus. But as we've seen, there are lots of other things of where people think it might have come from in terms of animal reservoirs, wet markets. And so one of the things, again, that I've been very interested in is the international kickback there has been against wet markets because of COVID-19. and how this is played into policies within countries that have been trying to really scale down wet markets for a long time. I said most of my fieldwork on this has been in India. We're working at the moment in an area of Assam where there is still a lot of backyard farming, where in most of the, particularly the peri-urban villages, most households will have a couple of cows, a couple of chickens. At most, they may have a more commercial chicken farm with perhaps one shed of 500 chickens. But the food systems are reasonably small and reasonably contained and reasonably low resource. So local villages sell to local markets, and local markets then sell back to people in the local population. And this is actually, in terms of the regions and the context, this is actually the best option for food hygiene, is to keep the animals alive as long as possible before you eat them. So actually it's more hygienic, and you're less likely to suffer food poisoning to buy a chicken live at the market, to take it back home, to slaughter it and to eat it immediately after it's been slaughtered. If meat is left out on the counters, largely in the open air, in high temperatures, it's more likely that you will get food poisoning as a result of that. And that goes both from the markets themselves not really having cold storage, back to homes not having cold storage. And yet, from a strategic level, there is a drive to really shut these markets down before there is the infrastructure in the regions to be able to support them. And that's something we've been trying to push very strongly. And it's similar, the wet markets that we see operating in India are very similar to the wet markets that I've seen operating in Africa, particularly, as I mentioned, in Malawi. So we see these markets that from a global north perspective look unhygienic, they look like something we want to move beyond, but actually for the contexts in which they serve the populations, they may be the best model. And so can we actually work with these markets to perhaps look at how can we bring up some aspects of the hygiene within those markets without actually just saying that they shouldn't have them and should move towards a supermarket system more like we have in the global north. And there are things around that. For instance, we know that one of the problems could be species being very closely mixed together. So stalls will tend to have perhaps live chickens in one cage, live ducks in the cage next to it. You tend to see pigeons in cages in markets quite often. There may be fish right next door. And actually what you want to do is stop the species mixing, not necessarily stopping the species being sold there alive. And actually it's just a little bit of that understanding, perhaps amongst the market traders, can make a big difference. And what we also see is that the more commercialized and the more modernized, and I put modernized in commercial in quotes, that those systems become, the more intensive the farming becomes. And as Kris mentioned, that can quite often stress the animals and make them much more susceptible to disease. And what we're seeing in some of the poultry farms, particularly in areas that are under climate stress, is that birds that are being treated for what the farmers assume is a bacterial infection is actually heat stress. And so the projects that I'm working on at the moment are specifically around antimicrobial resistance. And we're seeing that you could argue that the driver of antimicrobial resistance isn't actually the irrational use of antibiotics, it's the misdiagnosis of heat stress as a bacterial disease. And again, if you actually work with the farmers to give them a bit more understanding, to educate them, to look at what they can do instead, you can move beyond that. And the answer, it's very easy to look from the outside and say the answer to that is air-conditioned sheds. But again, it's not very easy to have air-conditioned sheds if you don't have good access to electricity, if you live in a rural area that isn't on the electricity grid. And so there may be an option there to tie this in with energy policy and to look at how do you have renewable but locally generated and locally used energy might actually be able to tie into some of these health systems as well. And obviously there are issues such as deforestation that we see as well. And again, when we're moving towards certainly kind of putting financial investment into an area, can we actually look at reforestation as part of the economic recovery of an area? Can we actually look at starting forest trails and tourism? Can we actually start to look at the type of wood that is grown? So for instance, one of the projects that we looked at in Malawi, where Mount Mulanje has been deforested, and they were looking to reforest Mount Mulanje. They worked very closely with local populations to ask what they wanted. One of the reasons Mount Mulanje has been deforested is because a lot of the local people go in and chop up firewood to use as fuel. and they use the firewood and the fuel that they buy, or they use for free, saves them having to buy it. And the money that they save by having to buy fuel and firewood, they use to pay for their children's education. And so actually, if you put money into funding children's education, their families no longer need to go and chop down firewood for free. And so actually you stop the forests being deforested. What we also found is that people did need to chop down the wood, for they made furniture with it, they made carvings that they sold to tourists. And so actually, if you reforested it with fast growing trees that you accepted that people were going to chop down, but that they would regrow regularly, you could actually work with the local community very well to look at the way that you could actually work holistically between the people and the environment. Another thing that we're getting very interested in India is actually the role of the common grazing grounds that the backyard farmers use as not only a source of free food, which enables the farmers to be able to afford to keep the backyard livestock, but also as a way of protecting the environment and the ecosystem services they provide. So we're starting to think of, could we look at models of small, relatively self-contained peri-urban areas that, for instance, generate their own biogas from dairy waste, that retain the dairy on common grazing land, that actually somehow landscape the common grazing lands to help with the ecosystem services, rather than actually just letting the city wash over the villages and letting these essentially peri-urban farming areas disappear and go to more intensive farming on the edge of the city. So that if we start to look at the system as a whole, and I think that's very much a planetary health way of doing it, we start to see all those interlinkages. And I think that the advantage of social science really comes into that, in that the social scientists are the ones who really go and talk to the farmers. The microbiologists go and swab the chickens, they swab the environment, they go in, put something in a test tube and come out again and do something with it in a lab. But the social scientists on the team are the ones who will actually sit down with the farmers. We will talk to them, we will have a cup of tea, we will show them photos. One of the things they're always really interested in is, what do farms in England look like? It doesn't matter what part of the world I'm in when I'm working with farmers, the thing they always want to see is what farms in England look like. So we've started making sure when we go out on our phone, we have pictures of farms in England. And what we're starting to do, and a couple of my colleagues in particular are starting to do, is to build up biosafety maps of farms that look very different to how we would construct those from a global north perspective. So a biosecure farm from a global north perspective would have foot dips as you go in, it would have environmentally controlled sheds, it would have closed sides, it would be almost hermetically sealed. But what you tend to get in that is very densely packed, very stressed birds. Whereas if you have a more open environment, they may be slightly more prone to, for instance, catching diseases from wild birds. But they also tend to have much stronger immune systems because they're living more natural lives. They tend to not travel so far, so they don't tend to mix so much with animals from other parts of the country. The food that they produce tends to be cooked in a different way, so there may be pathogens in the meat or in the milk, but actually those are eliminated at the point of cooking. So again, the villages we work with tend to drink unpasteurized milk, but they boil it before they drink it, and they boil it immediately before they drink it. So we start to look at kind of how the pathogens move around the system and the points at which they can enter and the points they're eliminated in a slightly different way. And we're very interested in this idea of particularly peri-urban regions on the edge of developing cities. Is there a way that we can retain a model of peri-urban agriculture that works into the future? You may have seen those statistics quite often given that by 2050, the world will be as urbanized as it's ever going to be. All of the urbanization really that will take place between now and 2050. And so actually what we have to bed in now, ideally we bed in before 2050. And if we can retain some peri-urban farms and perhaps peri-urban rings around developing cities, we think that has benefits both for human health, for animal health, and for environmental health going forward. So you can see this is all incredibly interlinked, and I've been looking at it specifically around COVID-19, and these are a couple of diagrams we've pulled out particularly on interconnectedness of issues with COVID-19. And this is really the typical SRI model of infection, which normally would be the red circle, which is just the number of infectious people, risk of transmission per interpersonal contact and transmission events. But with COVID-19, you see all these hundreds of other factors coming in as well. And a lot of those come from the social science side. There's one of the ones we've used is from the Lancet Planetary Health, and the other one, the slightly smaller and neater one, is from the World Economic Forum. But what they both show is this huge interconnection of different disciplines. And one of the things also with this, and whether it's really COVID-19 or anything else, is looking at what's the best solution. And this really touches on some of the things that I talked about yesterday in the ethics lecture. That there isn't always one solution that works for everybody. There are normally lots of different solutions, and parts of them work for some contexts, parts of them work for others. And what we're really trying to do is to understand what all of those contexts are and to put them together. Really, from the beginning of the pandemic, everybody has seen the silver bullet as being a vaccine. We've desperately been kind of hanging on, hoping for a vaccine to come. And actually now we can see that that's starting to play out. We can perhaps start to think more about, in a realistic time frame, of getting back to normal life. But there's been a lot of discussion about, do we actually want to go back to normal life in the resilience field that I kind of fit into better than anything else. We always say that we don't really want to bounce back, we want to bounce forward. If you bounce back into a condition that made you vulnerable in the first place, you're just going to be vulnerable to the next threat that comes along. You very much need to look back and learn what made you vulnerable and make sure that you bounce forward in a way that you're not vulnerable again. And there have been lots of various slogans. The new normal is used a lot. I mentioned again yesterday, I really like this one that came out of the World Conservation Society, which was the world not as we would, but as we would like it to be. No, this is really an opportunity in some ways to start from a blank slate and to reinvent the world the way that we would like it. We've seen, again, there are lots of different feelings around masks. It's the politicization of masks. Masks have been hugely interesting from a social perspective. Why have we seen something that is essentially protecting us from the disease be so hugely politicized? How have we seen such narratives going around? And also the group of 3 people at the bottom, you can see, are the authors of the Great Barrington Declaration, which was basically a cry for people to think about the economic damage that it out there as a debate piece rather than as the solution. And I think what they found is that most people didn't want to debate it. But what we're definitely seeing as well is differences of opinion, and people, there are some people on the edges of decisions, there are some people in the center of them, and actually where you are within society, whether you're marginalized or within the elite of society, probably affects which of those solutions is going to work best for you. The people who are suffering most from the economic lockdowns are the people who are poor and more marginalized in the first place. So it's not quite surprising that they're the ones who are shouting loudest to open up. We're also seeing that whether or not you have access to hospital care can make a huge difference. I moderate a couple of forums on Reddit, which are used primarily by Americans. And I was genuinely quite shocked in the early stages of the pandemic that Americans were more worried of catching the virus and being bankrupted by 2 or 3 weeks in hospital than they were of dying from the virus. And there was a real palpable fear that the medical bills associated with catching this could destroy a family. And I think when you look at that in terms of health systems, it really makes you realize that there are different health systems in different parts of the world. So one of the things that I think we need to think about is how do we decide between the various different solutions that there are? How do we look at whether this is an economic solution, whether it's something about normalizing changes in society, whether it's about ethical decisions and who we make them for? And I think this is really where the transdisciplinarity comes in. You really need huge different expertise and different areas of expertise in order to make these decisions. And very much in the UK, you may have heard of SAGE, which is the emergency group, or that advises government. And SAGE is a reasonably loose organisation. It has some core members, but the idea of SAGE is that it's a group on which the government can call to bring in the expertise for whatever event they need. And so there are some stock members who will deal with epidemics and epidemic planning, but it also can reach out very quickly to whatever expertise it needs. You could argue it hasn't done particularly well if you look at the UK's number of cases that we've had. but certainly what it has done is allowed the situation to be considered from all angles, both from epidemiologists, from virologists, from economists, from behavioural scientists, and has allowed them to discuss things together. And that very much draws back on the Delphi method, which was a method that was invented by the Rand Corporation during the Cold War, which looked at kind of how would you imagine the outcome of a nuclear war? Nobody had actually lived through a nuclear war. Nobody really knew how people would react or what the impact of it would be. So nobody could actually sit down and plan out what they thought it would really be like. But certain people had expertise around, how people had worked, what behaviour had been like in the war, what had frightened people, what they'd been allowed, who they'd listened to, how they felt about things, that you could kind of put together to make the best guess of a group of experts. And I think that's really what we need now. And I think what Planetary Health again does very well, that Planetary Health pulls in lots of different disciplines and lots of different ideas, from whether it's from public health or from medicine or from virology or from environmental science, from conservationists, from biodiversity, from anthropologists, and it looks at the problem from lots of different angles and tries to come up with something that works for everybody. And where this has particular interest to me from some of my previous work is around the idea of collective intelligence, which was a term that was invented by Pierre Levy, who was a Canadian philosopher who then went into designing computer library systems, who made the point that nobody knows everything, but everybody knows something. And actually what computer science allows us to do is to put all those bits of something that people know together very, very quickly. It allows conversations to happen sometimes simultaneously amongst hundreds of experts who can actually between them try and come to some kind of compromise. And that what we're seeing as we move forward into kind of these new worlds, and certainly looking at how that plays out over different parts of the world, is we have a real opportunity to really do a social experiment around collective intelligence. Can we actually plan the world that moves forward in a way that isn't a one-size-fits-all solution, but that actually simultaneously thinks of all the different solutions that will work for all the different parts of the world? I think some of you may be aware of Amartya Sen, who's an economist, who's certainly very famous in development studies. And a lot of his work has been about how do you make choices when you don't have all the resources you would like to. We're very privileged in the global north to usually be able to decide what we want and then to work our way towards that. But if there is no way that you're ever going to have that, if you're only ever going to be a poor rural farmer, how do you make the decisions of how you would make your life to go? And I think a lot of his ideas and a lot of his work really rings true at the moment when we have something like COVID, where what we would most like is for it to just go away, but it's not going to. And we have to weigh up what he would call suboptimal options between perhaps keeping lockdown and impacting on the economy versus not locking down and having more disease spread. How do you actually weigh those two options against each other, and from an economics basis, decide which one you're going to go with? And also within that, inevitably, there is going to be disagreement between people because there is no best option. And so actually you're going to have to negotiate those politics around that and make those decisions, as well as actually just being able to say, this is the way forward, because actually statistically and scientifically there may not be an ideal solution. And that's where again social science needs to come in terms of how do you negotiate that space. So kind of why planetary health, and why is planetary health, I think, particularly valid for this? And I think it does bring together all of those. You don't really see any planetary health topic that you can say belongs to one discipline. It brings particularly the public health and the environment together. But I still do think there's more room in it for social sciences, and particularly for the human geography and anthropology. And I think, certainly, as I said, we have done some of this looking particularly at the ethical basis within the planetary health textbook. And there's also an excellent book I'd recommend by Steve Quilly and the team at Toronto University around health in the Anthropocene, which looks at again, a lot of these more sociological and societal aspects. I think what we always need to keep in mind is, and I love this cartoon, the difference of equality versus equity versus social justice. And so actually, as we're looking for planetary health solutions, who are those solutions actually really benefiting? And it's always used with this idea of a fence, that you have a tall guy, a medium-sized guy and a short guy. And that equality is really giving them, you give them all the same size box, but it still doesn't really help the little guy all that much. And so if you give him 2 boxes and you don't bother to give the tall guy a box at all, that's actually equity. They can now all see over the fence, ideally. But what would be even better is to take the fence away, so you kind of don't need to give them these leg ups. But I would then argue, well, actually, what does that do for the people who've paid to be in the stadium? Is that really social justice if they're now getting something for free that other people have paid for? And if you don't take that into account and consider how those other people in the stadium will feel, that's where you start to run into some of the political problems. And so I think you do actually need to think beyond kind of some of our current thinking. Very, very briefly, I'm just going to go into this, which was basically saying, I was talking about COVID-19. What I haven't really mentioned so much is the medical side of it. I've been talking about the social science. And there obviously are lots of other issues around, as we said, deforestation, about whether or not people wear masks. You can have a group of people wearing masks. You only need one, the lady in the middle with the mask not right, around her chin. And actually that whole area could become infected again. And this is one of my favorite things. So when we talk about unhealthy geographies, which I do with my colleagues, we talk about geography and how to heal the earth. And we always show these pictures of kind of, the earth and the natural beauty, but it doesn't actually have any people in it. And actually, we don't really want an earth with no people in it. We want a beautiful earth that has people in it as well. And I think that's one of the hardest things we have to figure out how to get there. The picture, once we need a picture that looks like that, but without all of these things behind it. They may be invisible to us if we're sitting in the square, but they're still there. And so we really want a world that looks like this, that's actually beautiful everywhere. And I think it's really the social science that will help us to get there and to bring it more into the studies to make sure the impact that it has, perhaps on the fishermen for the people who live in the rural areas, the farmers who grow the food that feeds the cities, to make sure that we actually, as we said, move forward to the world as we would like it to be rather than the world as it has been. And that's it. Thank you.
Thank you very much, Jennifer. I'm amazed by both presentations because both are pointing to the complexities behind the entry points and to the complexities of bringing together social sciences and the natural sciences and how necessary it is when we take planetary health serious.
So the first question goes to Kris. What will be the benefit of applying planetary health lens in pandemic prevention? And do you have experience sharing the advantages of the planetary health narrative with decision makers or funders? That's one question from a participant.
Yeah, sure. Yeah, I think this is the perennial question. Can we detect the value add of planetary health perspective over traditional models of health protection or health management? Planetary health is still very young as a discipline. These types of things, I think, as far as I'm aware, are not well evaluated. There has been some efforts in disciplines that are kind of related from which planetary health has emerged, where there's been more efforts to look at the value add, what are the distinct advantages of taking, for example, an interdisciplinary approach in managing the human-wildlife interface with respect to the spillover of zoonotic diseases. These types of questions have been asked in One Health and Eco Health, and before that, ecological public health and things like that. Planetary health really only emerged in 2015, so it's still very early days. And a recent analysis of the literature suggested that only about 8% of papers that are identifying with planetary health are even primary research articles. Almost everything in the planetary health publishing space are commentaries, reviews, calls to arms. So there's a lot of kind of recycling of the main high-level concepts, and at the moment, much less nuts and bolts that can be evaluated for this type of thing. That said, the lessons that we have from the same kind of general perspective from these other areas, I think it's very clear that a response to an increasing specialization in human health is backfiring in lots of different ways. That there's been this sort of shift from what used to be a shared perspective on veterinary and human medicine that then became very, very narrow, very, very specialized, very, very reductionist on human health protection. That has absolutely delivered some successes, but it is also delivering some areas where we're seeing backfires. And I think some of those cases that I know well are mostly related to the transmission of diseases between wildlife and people. I was really interested to hear Jennifer's reflections on the smallholder farming, the local market system, this kind of like what I imagine to be a diverse and biodiverse, a dietary diverse, a biodiverse kind of system in comparison to large scale intensive agriculture. The focus in emerging infectious disease world has very much in this pandemic been about the wildlife origin of zoonoses, but we really need to think of the counterfactual, which is, okay, if we eliminate these types of systems and push towards something much more intensive, we also have a number of examples of emerging infections. We have examples of intensive agriculture promoting the spread of a bunch of different diseases, including novel diseases. So you have to think, I think, really about the pros and cons of these different perspectives. It's a very difficult question for me to answer. Maybe Jennifer has something a bit specific that she can add to that.
One thing that kind of really strikes us, and particularly with the small scale farming, is strategic decisions are quite often made by governments who have to make a profit. And actually, if a lot of the planetary health solutions that certainly would look to things like perhaps natural capital aren't easy to monetize. And I think that is a real challenge. There's no big business making a profit out of smallholder farmers maintaining their smallholder farmer systems and keeping their food system contained within their local area and their local wet markets. So it's quite difficult to get political buy-in to that as well. And I wonder whether that will be, one of the real values of planetary health as an emerging discipline now, is the young researchers it will bring up and the students who perhaps don't go into planetary health academia, but who go out into the policy world. And whether that will be, in some ways, and we always talk with the urgency of planetary health, we may not have 20 years, but actually in 20 years' time, we may have a very different political generation who are actually much less focused on monetary gain and actually think that protecting natural capital has much more value. And the generation that's grown up with Greta Thunberg and kind of see her as the way forward, the kids who look to her and identify with her are going to be the leaders of the future. And so this may, there's a lot of things that it takes a while to trickle through. And I think what perhaps is valuable for that from an academic point of view is case studies. And I think actually that's something that the Planetary Health Alliance does very well. Sometimes because this is so diverse and you need to look at it from so many angles, it is very difficult to do primary research. And actually the secondary research and synthesis and analysis of projects out there may be, again, another place where planetary health's value really lies.
Thank you so much, Jennifer, for enabling us to learn from that explanation. So I would like also to ask, what are the critical threats to biodiversity from human activity, and how can we influence politics and commerce to protect biodiversity?
I can offer some thoughts on that. I think the reference, Jennifer's reference to natural capital, kind of speaks to a model that's been around in conservation biology circles for a long time, this idea that you can quantify the ecosystem services and place not necessarily a monetary value, but some kind of societal value that can then be factored into decision making. And the whole kind of momentum behind that field is the recognition that that money talks, that's the thing that decision makers and politicians are really motivated by. So it's almost as if they've had to adapt the way that we value components of the environment into the language of a policymaker or a politician or a decision maker. I don't see that as being like an area where planetary health is forging necessarily new ground. What possibly they can do, where ecologists and environmental scientists may have failed before, is the connection with the societal decision making that Jennifer was really sort of stressing. This because of these macroeconomic and macroecological drivers sort of working together, there is this opportunity for us to do that side of things much, much better than we have been doing in ecosystem services evaluation for a long time. And there are some signs of success that this approach is being picked up by governments. For example, you know, natural capital in the UK has been baked into the 20-year environment plan. So it's there right alongside, you know, other metrics of biodiversity value for the consumption of policy makers and politicians, which I think is a really remarkable achievement, particularly in the UK. It is absolutely true that the critical threats to biodiversity are anthropogenic, they're human caused. This, I think, comes back to the competition for space. Humans want stuff for themselves, and that encroaches upon the habitats of other species. That is just that is the hallmark of the Anthropocene, that our footprint on the planet has stretched now so far that this is the primary driver for the loss of animal abundance and plant and animal diversity globally. So that's absolutely true. So how do we sort of claw that back? I think it definitely lies in this ecosystem service, natural capital accounting type framework to bridge the gap between how we want to make decisions and what nature needs to survive.
Yeah, I mean, I would say that I think I'm perhaps quite cynical about politicians. I think most politicians are politicians because they want to be politicians rather than because they really believe in a cause. So I think most politicians will generally do what they think will win them votes. So the more the public pressures them to value the environment, to value natural capital, the more that will be put onto political agendas. And again, I think that is, you know, we're seeing a younger generation who do care more about that than they have in the past. I think it's really noticeable. I think kind of people who are vegetarian today tend to be vegetarian for ecological reasons more than they do for animal welfare reasons. And that's partly because I think animal welfare has probably increased over the last 20 or 30 years, but I think it's also there's more environmental awareness. And so I think it's, you know, I'm quite impressed with the way that the environment is taught at my children's school. My kids are 11 and 9, and the way that the environment is taught at their school is actually very impressive, you know, much better understanding of the environment than I had. And that probably comes through, you know, a generation of teachers who were interested in it themselves, bringing it onto the curriculum and passing it on to children who will equally be more interested in it again in the future. So I think it is kind of, it's keeping that momentum going. I think we have started to get a momentum and an interest, and it's making sure that we can keep that moving.
Can I just pose a question back to Jennifer before we move on to the next question? I think that's a really inspirational sort of message. I see the same thing with my kids at their school. I've been personally moved by the youth climate movement, you know, in the last sort of year or 2 years. But what we have seen is a sort of a countercurrent at the political level. So we've seen a shift towards more insular governments that are looking after their own interests more and more, which I sort of interpret as some kind of reaction to diminishing competition, increasing imperative for economic growth in an era where we've never had more information about the value of the environment. We've also been, you know, had generations in the past that were motivated, protesting, armed with information about nuclear energy, climate and climate change, environmental pollution. There was the birth of the circular economy narrative in the 80s, and the limits to growth model, and all that kind of stuff has come out 40 odd years ago. So I'm really curious as to hear what specifically is it that you think distinguishes this generation and this movement from those past generations and past movements?
I do think there are some things that are more normalized, and I'd say things like my kids don't even think about where something should go before they put it in the recycling bin. You know, they're looking around for a recycling bin if we're in a cafe or we're out in the street. And kind of, it is small things. The way that we buy things second, you know, when I was a child, nobody bought things secondhand unless they were poverty stricken, and if you had something on that was secondhand, it was embarrassing. Whereas my kids now don't think anything about, if we go in and have a look in a charity shop and there's a jacket they like, or, their bike's secondhand, or they sell things on eBay. And so I think there is that kind of slight, it's a subtle change, but it's a change from my generation when I was a kid. And I think there is also a bit of a move back towards, gardening as a hobby, of kind of having some outdoor space, of looking after plants. Just that it's little bits of more awareness. My kids are quite lucky in that their school's got quite a lot of green space and fields around it. But they have like a school gardening club where the school has an allotment and the parents can go and help in the allotment on a Saturday morning. And that seems to be just kind of those bits of awareness seem to be there in a way that they weren't so much when I was a child. And they're kind of small and they're kind of little, but they're definitely getting back there. And it was a generation that was lost, because I think they were there in my grandparents' generation. And even when I was a child, people around me, 2 or 3 of the houses in our street had chickens in their backyard. And then there was just kind of 20 years where that went completely. And now it seems to be trickling back again. And I think it will be kind of moving that more towards a more organic, a more caring. And I think even on the political side, hopefully we might have turned a corner with that. And I think Biden stood on a I care more platform. And that's, that won, it won marginally, but it was a change. It was back to science denialism doesn't work. This kind of macho posturing doesn't work. Actually, we are going to go for the candidate who looks like they care a bit more. And so I think it's small gains, but I think the gains are there.
Perhaps I want to add also, I feel that the Fridays for Future generation is very political. It's less ideological, but very determined and very strategic. And if you look on the UN level, but also on the EU level and on other levels, what we have reached in the last year is a clear effect already of their work. Without Fridays for Future, we would not have the discussion in the European Parliament between 55 or 60 kind of emission target reductions and so on and so forth. So both Greta Thunberg and Luisa Neubauer and others are not shy to talk to a CEO, to go to the UN, and the way they do that is very impactful. And I think that will continue, and it has to continue. And we also in the planetary health movement have to be political and find a way to bring this message to our decision makers. I'm not as cynical as Jennifer is about the politicians. I think also many of them are willing to be educated, willing to learn. They start seeing that there are more issues. I also see, at least in Europe, a new opening through what is happening with COVID. But we need to jump into there and be effective, especially also from the health community. I think the health community has a very strong kind of, can play a very strong role in changing the game.
Yeah, we have only one question left. Let me just ask this. Taking into account concerning younger generation, as you've just spoken earlier, now with regards to COVID-19 in Africa, apart from the possibility of less susceptibility of human host in Africa, for instance, youthfulness, could the existence of the vectors that carry coronaviruses with some similarities be playing a role in considering low numbers of the cases?
Yeah, I mean, I guess that's difficult because we're not entirely sure what the vector was. That everybody's kind of pointing the finger at bats. I've personally never seen any bats in Africa, but they're obviously there because they were one of the vectors for Ebola. In India, there are bats everywhere. You get, in villages that you get trees that are absolutely full of bats. They quite often kind of congregate around animal drinking troughs and things. So I think there is quite often, what is the vector compared to what is the opportunity for the vector to pass the disease to humans? So I said that it's a big issue in India is kind of wild birds because it's hard to keep the chicken sheds closed unless you can air condition them, and there isn't the electricity infrastructure to do it. So if can you eliminate the vector, or can you live with the vector? And actually, if you can't eliminate the vector, keeping flock sizes small so that if it is, it's only 500 birds that get infected rather than it immediately spreads through a huge flock of 20,000 birds, again is kind of more appropriate for that context. So I think it's looking at kind of not only necessarily the vector, but where the weakness of the vector being able to infect its next host comes from, and are the systems that we're creating enhancing those vulnerabilities and creating more points of weakness. That would certainly be one of my takeaways.
Just to add to that, I think that's all absolutely true with respect to the emergence of diseases in general and spillover of zoonotic pathogens. COVID is at a global level a human-to-human transmission pathogen. It's spilled over what looks like maybe, you know, once or a small number of times into a local population. Almost 100% of cases globally now have come from human-to-human transmission specifically. So I'm not concerned that there is a wildlife vector that is contributing to the caseload of COVID-19 at a global scale at this point. I'm not sure there's any evidence of that. There is some really weird stuff. There is COVID being backspilling into other wildlife populations. For example, in Denmark, there was the case of mink taking on COVID and being the source of a recombination event or some kind of modification event, and then that getting back into people. So there has been a small number of cases where we have had sort of fresh spillover of COVID, but at the moment, the very, very vast majority of COVID cases globally are from human-to-human transmission.
Yeah, thank you very much to Kris and Jennifer. I think it's a real great closing of this first series, because it's coming back to the opportunities of planetary health, why a planetary health perspective is necessary, but also what are some of the key characteristics that you allow for the complexities to be there, that you really look at transdisciplinary approaches and to create settings where we can look together at different things and learn from each other, with some of the most difficult challenges of our time kind of in the focus. This is now closing the first 4 lectures and the action workshops. Thank you very much for everyone who has participated. I think we have seen strong participation in the 4 lectures and strong participation in the 3 action workshops. The core team will take all the learnings from the action workshops and also the feedbacks that we've gotten in between to come together after the Christmas break to see how to move on into a next phase. And we will reach out to you to communicate kind of what this will look like. And we are very much looking forward to getting your feedback and also to see how you will participate in the further development of our work in East Africa. So whoever has ideas or thoughts or reflections or want to connect us with things, please reach out to Melvin. We will come back in early January, invite you for more meetings or also lectures.
I would like to thank you very much for all the participants who have been able to join our workshops and lectures, and also specifically to thank our today's speakers for creating time to offer the wonderful lecture on COVID-19 and through sharing their project experiences and work. And then considering the next phase of our activities, as just Martin has said, we welcome you all to share ideas and contact us directly. I will also focus on your input ideas through the last workshop we had. And we also invite you to 2 major events for the Planetary Health Alliance. The first one will be on Clinicians for Planetary Health call event that will take place on January 15th. And this will focus on the intersection of planetary health and child health, and will feature several leaders of new child health in planetary health initiative. And also we welcome you to the online planetary health annual meeting that will be held in the April of 25th to 30th. Yeah, thank you so much for all participating in our activities.